Hello, everyone, and welcome to our session today. We're going to be talking about workplace disability management assessments, which are available to mining associations and organizations for free for a limited time. Thank you to everyone who's taken the time to join us today. I'll ask that folks put your microphones on mute if you haven't done that already. And I'll also let you know that this session is being recorded. And so if you don't want to be visible, please be sure to hide your camera and so on. We are very, very excited to bring this presentation to you today. And we think we'll take about an hour, and we'll have a few minutes for question and answer towards the end of the discussion. My name is Leslie Wolcott. I serve as the Director of Equity, Diversity and Inclusion at the Mining Industry Human Resources Council, or MiHR for short. I'm happy to be joining you from where I live in Peterborough, Ontario, the Treaty and Traditional Territory of the Mississauga Anishinaabe, known as Nogo-Jiwanang, which refers to a traditional gathering place on the Otonabee River. I offer my gratitude for the care, stewardship, and teachings about the land and our relations shared with First Nations peoples. May we reflect these teachings in our dialogue today and every day. Well, if you could move to the next piece, the next slide. Before introducing our speakers, I'd like to acknowledge the National Institute of Disability Management and Research, which is located on the West Coast. The National Institute is otherwise known as MiHR. We appreciate the support it has provided to us at MiHR and the support it's given for this session and the disability management assessments that NIDMAR is able to make available to the sector. NIDMAR is an internationally recognized organization committed to reducing the human, social, and economic costs of disability. NIDMAR's primary focus is the promotion of education, professionalization, and program standards, which international research has proven is the most effective way of restoring and maintaining workers' abilities, while also reducing the costs of disability for workers, employers, government, and insurance. We also are happy to tell you a little bit more about MiHR. If you're not familiar with MiHR, we are an independent nonprofit organization that leads collaboration to identify and address the human resources and labor market challenges facing the Canadian minerals and metals sector. Our programs cover labor market analysis, industry training, occupational standards, and certification. We also pursue programming and activities in career development, inclusion and diversity, and strategic partnerships and engagement. More information can be found at mihr.ca. With that and these introductions, I'm pleased to begin with some introductions of today's speakers. Wolfgang Zimmerman serves as Executive Director of NIDMAR, and Steve Inouye as NIDMAR's Director of Program Assessments. Wolfgang has been involved in the disability management field since the late 1980s and has held a wide range of private and public sector appointments in disability management advocacy. We're very excited to have Wolfgang with us today. Steve is a certified disability management professional and a certified consensus-based disability management auditor with 25 years of experience in disability management. We're equally excited to have Steve with us today. Combined, we've got a lot of know-how in the room, along with the expertise that you're bringing as guests, and we're really excited about that. Thank you, Wolfgang and Steve, for joining us today to present NIDMAR's mandate and for being so gracious and sharing your knowledge and insights with us. We're most appreciative. Wolfgang and Steve will also be providing information about these free workplace assessments and how you, your company, and employees can benefit by participating. Before getting into their presentation, I'd like to mention that MiHR as part of its equity, diversity, and inclusion efforts and support around EDI in the sector. Under our mining sector and solution strategy for the clean economy, also known as M4S, this is a project that's undertaking several activities to support the inclusion of persons with disabilities within the mining sector. And we're just putting a little overview chart of the whole project into the chat for folks for your information. But I'll just speak to the 2 or 3 specific things that we have happening with regard to supporting persons with disabilities and thinking more about integrating persons with disabilities into the sector. So we're undertaking some research regarding automation and accommodating persons with disabilities. Well, I think there's the next slide that you might be on. There you go. We've got this research is going on. It will result in a 10-page report that looks at opportunities for enhanced integration of persons with disabilities in the sector owing to automation. And that's going to involve literature review, a review of existing literature, and 3 focus groups with persons with disabilities in the sector. And so if you are able or interested in participating in those as a person, potentially as a person with a disability, please reach out to us at inclusion@mir.ca to let us know about that. The next project that we're looking at is a project that's focused on career development, and it's looking at the factors and timing of career decisions. And that will focus on, include a focus on persons with disabilities, along with looking at factors and timing of career decisions amongst Indigenous and newcomer youth. So we're really very excited about that. And again, if you're interested in participating in a focus group around that piece, we're happy to hear from you. Our aim with this last project is to inform career awareness in mining and to support related communications and materials, such as through our Mining Needs You campaign. Watch for this report and a related webinar that will share our findings. And finally, we have this partnership with NIDMAR that we're going to elaborate on today. And this partnership aims to support effective disability management processes and ultimately support the prioritization of EDI across Canada's mining industry. Our focus objectives for the day are to provide you with an overview of the free workplace disability management assessments, to provide a summary of some accessibility requirements and workers' compensation requirements, to facilitate learning of strategies that will help with integrating persons with disabilities, providing safe workplaces for employees with disabilities, and minimizing workplace incidents for all workers. We also hope that our discussion today will enable you as attendees to apply for the workplace disability management assessments through your organization. And so you'll learn more about that through today's session. As a bit of a starting reflection, I urge everyone to pause and reflect on who is here today and who in your circle you may be able to engage in this discussion and bring into this dialogue and into discussions around integrating persons with disabilities into the sector. Without further ado, Wolfgang and Steve, I look forward to your presentation. There will be some time for Q&A at the end, and we ask you to place questions in the chat and we'll moderate them during the Q&A. I also promised Steve and Wolfgang that I would give them time cues, so you might hear me jumping in with that to help keep folks on time. Okay, so over to you.
Great. Yeah, thanks, Steve. Yeah, thanks a lot, Leslie, for that kind introduction, and also congratulations to you and everybody else at MiHR to have organized this session and kind of taking the leadership in moving this whole EDI agenda forward. And I thought I'd just take a few minutes before passing a more detailed presentation over to my colleague Steve here, is that it's certainly an area that I've been involved in for way too long that I can actually remember some, I don't want to go into detail, but certainly many decades ago, coming out of the forest industry here, it was the first week on the job for me. And it was one of those things when, more than 4 decades ago now, I guess health and safety was not necessarily a priority in organizations, certainly in the forest industry here. And this was a logging camp on the West Coast, worked for a company called McMillan Waddell, which at the time was the largest employer in British Columbia, the biggest forest product company in Canada. And so it was one of those things where, here's the power saw, good luck, go for it. And this is how you fall trees. And started Monday morning, and on Friday, a 50-foot alder came down on me and ended up breaking my back. So it was a huge challenge, but it was important. And even in those days, I mean, obviously we didn't have EDI. That was not even something that was heard of. We didn't have international codes of practice. We didn't have the duty to accommodate. We didn't have collective agreements or any of those things. But the company ultimately accepted responsibility, and it was really the collaboration between the union, which was the steelworkers, or in those days it was the IWA, International Woodworkers, that merged into the steelworkers, that made all the difference. The company accepting responsibility, even though there was, of course, no legal responsibility per se, because it was a workers' compensation accident, and so being a no-fault system as part of that, but certainly there was a huge level of moral obligation that the organization accepted. And in this case, and the reason I'm raising it and providing perhaps a bit of perspective on this is what were deciding factors for me being able to go back to work and staying gainfully employed for more than 4 decades after my accident now, was really the fact that ultimately it was the attitude that prevailed, and that is exactly the same issue that we have to this day. We were a logging camp of about 450 individuals, 450 workers, just outside of Port Alberni. We had a fatality and a fatal accident on average about every 18 months. So if you, across the entire company, about a dozen, 10 to 12, some years a few less, some years more, every year. This camp was about as inaccessible as you could imagine. It was a logging camp in the bush, basically. And even though I had, fortunately, I had initially graduated in civil and forest engineering, and there was a commitment for me to go back to work. And if it hadn't been for the attitude of the workplace, which is exactly what applies to this day still, I would never have gone back to work. But it took the engineering department about 3 to 4 hours to figure out how to build safe access to the building. And then we had, given the size, we had a construction crew that the camp basically employed. And so took them a week to actually build physical access in terms of the ramps on 2 sides of the building, so that you'd be able to get safely in and out of the building using a wheelchair, and then to modify doors, washrooms, and everything else. And so it's obviously a function of suitability of the individual. It's a function of matching skills and abilities, but ultimately it's a function of attitude. Because if it had not been for the supportive attitude on the part of the union and on the part of the company, the fact that the building was completely inaccessible would have been forever the excuse why I could not go back to work. And after I was lucky to get back to work, there were a number of other individuals that had been severely injured, several in particular that came back and utilized this. So that's really the key, and that is the same message that we have today. All too often we see, and Leslie referred to the fact that I've been involved in this space for a few years. I had the privilege of being one of 4 people looking after our WCB here in British Columbia for more than 6 years, and building a new disability strategy for the province. But the same issues that we faced all those years ago, we are still facing today, that it is the attitude that is the greatest barrier towards finding an accommodation. I always refer to the 3 C's of effective disability management, and that is commitment of the organization, collaboration between all the workplace parties, and communication amongst all of the stakeholders. And unless we address this in an effective way, and we have the leadership, and in that regard, I just briefly want to refer to an experience when Weyerhaeuser, a huge U.S. forest products company, bought McMillan Waddell in 1999 for $3.5 billion. I had the privilege, and I was fortunate to be transferred to Weyerhaeuser, even though out of 450 individuals at McMillan Waddell, only 100 of us survived that were on the corporate side. But the leadership at Weyerhaeuser required every manager and every vice president to report every 3 months, not only on health and safety, which had been a standard, but also on return to work and disability management outcomes. And it radically changed the attitude in the workplace. Steve will talk about this in some more detail, but 80% of all impairments happen during somebody's working life. And if an organization doesn't accommodate their own employees who acquire an impairment, they'll never hire somebody with a disability from the outside. That is just that's just the reality. But if you've accommodated somebody, some of your own employees, and that is in most cases not all that difficult, then you will be far more open towards hiring somebody from the outside. And that's why effective return to work for your own employees is a key strategy in terms of linking it to ESG and equity, diversity, and inclusion, because you'll reduce the stigma, whether it's a mental health or whether it's a physical health impairment that we are dealing with. And of course, you'll be able to, in many cases, address also the regulatory environment, whether that comes through being more prepared for accessibility legislation that we are continuously seeing, or as you know, we are finally catching up here in BC, where as of January 1st, 2024, under the Workers' Compensation Act, there will be a return to work obligation. So that's really the key message that I want to drive home, is that we know what the tools are, we know how we can make a difference. It is really up to each and every one of you, and certainly I very much applaud Leslie and Mir and all the other members of the team in taking this on and driving this agenda forward, because if you don't get accommodated, all too often, and I've had this happen sadly to several of my colleagues, friends in the forest industry who weren't accommodated and who decided that life wasn't worth living anymore, when in fact all that somebody needed to do was to provide them with ongoing means, with ongoing support in terms of being able to carry on. And as we all too often see, we have 1.4 million Canadians with disabilities that live in poverty and homelessness, addiction, overdose. All of these are pivotal factors. It is not that complicated. It's not that difficult. It is really the attitude of the workplace. I want to make a difference because whatever I do for somebody else today may benefit an individual personally tomorrow. So with that, I'll hand it over for a more detailed conversation to my friend Steve.
Thanks, Wolfgang, and thanks for sharing, and thanks again to MiHR. These are really important opportunities that we don't get every day to really learn more about disabilities and disability management, and also the opportunities as workplaces to really take advantage of some of the opportunity there. I think I feel privileged to be working at NIDMAR for a couple of reasons, but one of them, when speaking with employers, is this is one of those rare areas where there's truly an opportunity, a win-win opportunity for employers to retain people, to really retain a lot of precious knowledge, skills, training, and experience that have been provided and invested into their workforce, reduce costs, and for employees, gosh, it could be as simple as helping them stay connected to work a little bit longer and maintain their income a bit longer, or as Wolfgang pointed out, prevent someone from moving into poverty and joining a really tragically large group of our population that many of us are unaware of. So anyhow, I'm going to jump into a number of slides right now, and we're going to move through quite a bit of information fairly quickly. But as Leslie had mentioned, please, if you have any questions, please make a note of those, as we will provide some time at the end of the presentation to take some questions that you may have. And as well, we'll be available after this webinar as well if there's anyone that we can't get to during this time. So what I will do now is share my screen. Okay. Leslie, Wolfgang, can you see the slide okay? Maybe
Yep.
you just nod your head. Great. Okay.
Looks good.
Great. So again, thank you for joining us. And the title of our slides today is Building a Culture of Accommodation in the Workplace. And to start off, would also like to make an acknowledgement that NIDMAR respectfully acknowledges that our offices are in the beautiful Alberni Valley, located on the traditional and unceded territories of the Hupetchesset and the Sitchat First Nations, which are two of the 14 nations of the Nuu-chah-nulth people of Western Vancouver Island. I am also joining you and grateful to be on the Semiahmoo First Nation, to be residing on and working on their beautiful traditional and unceded territories and the broader territory of the Coast Salish peoples in the British Columbia area. Okay. Disability management programs are grounded in economic and social imperatives. There is a significant global business rationale for this. Every day, 7,500 workers die from a work-related accident or disease, which equals 2.78 million each year. An additional 374 million workers suffer non-fatal occupational accidents each year. With this comes an economic burden that is 4% of global GDP, and up to 6% in some countries. Across Canada, annually, there are 250,000 occupational lost time injury claims. Of those, there's 951 fatalities from work-related accidents and diseases, and a ratio of permanent disabilities to fatalities of 25:1. The cost of disability-related absence is $16.6 billion, or 2.4% of the gross national payroll. Mental health and related impairments are also on the rise. In any given week, at least 500,000 employed Canadians are unable to work due to mental health problems. The economic burden of mental health and mental illness in Canada is estimated at $51 billion each year and rising. Over the last 5 years alone, absences from work due to illness and disability have increased 20%, according to Statistics Canada. Nearly 4,000 Canadians die by suicide each year, which is an average of almost 11 per day. And the suicide rate for unemployed persons with disabilities is approximately 40 times the average of the population. There are historic challenges to note. High levels of unemployment and associated poverty for 1.4 million persons with disabilities in Canada today. Canada is no exception from this social, economic, and public policy conundrum for governments around the world. This has led to a diverse range of program, policy, and legislative interventions. However, there's only a 0.65 to 0.85% annual outflow rate from disability Social Security. There have been socioeconomic achievements through early intervention, case management, and causation-specific accommodation strategies, reduced time on disability claims, significantly lowered long-term disability rates, and reduction in indirect disability-related administrative costs, such as costs to replace or train someone when an employee is absent due to a disability. This raises a question of what we can achieve with effective disability management programs in the workplace. We can address these labor market issues, such as increasing mental health issues, aging workforce, and reduced labor force availability. In addition, we can accommodate long-term COVID and long COVID health challenges that have arisen more recently. To put this into perspective, effective disability management can reduce disability-related expenditures by 30 to 50%, reduce long-term disability uptake by up to 50%, generate a return on investment of $5 for every $1 spent, and maintain attachment to the pre-disability employer, retaining the training, skills, and experience of the individual. This is a codification of key success elements that NIDMAR has been connected with. Starting with, in 1998, the International Labor Organization did a job retention and return to work strategies study. This led to the ILO's Code of Practice on Managing Disability in the Workplace in 2002, which we'll provide a link for you to. As well, this led to the development of occupational standards, best practice, professional and program standards in disability management and return to work, principally supported through the Government of Canada. Now, this took place from 1998 to 2003 and was a significant milestone. In addition, during this time, not connected with NIDMAR itself, but the United Nations Convention on the Rights of Persons with Disabilities was also issued in 2008. More recently, the International Social Security Association, or ISA, developed best practice guidelines on return to work and reintegration in 2013 with NIDMAR. There are a number of universal key success factors that have been identified. And I'm going to run through a number of these. So one of them is injury prevention and safety programs. Another is health promotion and wellness programs. Early intervention combined with formal return to work programs. Policies and procedures that are jointly endorsed by both labor and management. Benefit program design. Internal and external communications and systems. Education in the workforce. Transitional work options made available. Performing workplace accommodations when workers have disabilities. Identification of key workplace personnel involved. identification of accountability, regulation, and supportive enterprise cultures. Now, in June 2019, the Accessible Canada Act was passed by the federal Parliament as part of a federal strategy. It identifies greater equitable employment for persons with disabilities as the #1 public policy challenge facing us. It also reflects the 1+1 rule. On average, an individual with a mental or physical health impairment after just 1 year on disability support will have a 1% or less chance of ever working again. So how do we increase the employment rate for persons with disabilities, which has remained unchanged for the last 10 years? Recognizing that employers are the key, evidence-based research indicates that employers with a dedicated disability management program will accommodate their own employees who acquire a mental or physical health impairment, and will, over time, develop appropriate accommodation strategies, policies, and practices. This will also be building a culture of accommodation, ultimately removing the disability stigma, which is often associated with the hiring of persons with disabilities from outside the organization. There's 3 pillars in this initiative. The first is focusing on education through both academic and continuing education. The second is promoting professionalization through disability management certification. The third is employer support to implement and improve return to work and disability management programs. So the first pillar of this, the education strategy, involves building a specialist workforce. Now, this is done through offering scholarships in the full and part-time academic Bachelor of Disability Management program offered through Pacific Coast University for Workplace Health Sciences, PCU-WHS. Also, providing residents with free upskilling through continuing education courses also offered through the Pacific Coast University for Workplace Health Sciences. Now, a second pillar to this strategy is professionalization. And this involves promoting individuals to obtain the Certified Disability Management Professional, or CDMP designation. This is offered under the auspices of the International Disability Management Standards Council, or IDMSC. And in Canada, it's administered through NIDMAR. In Canada, there's over 800 CDMPs. So these are 800 certified disability management professionals nationally. Globally, there's more than 4,000 CDMPs in 20 different countries. This strategy provides funding for 50 individuals per year over 3 years to write the CDMP examination. The development of occupational standards has involved and identified a number of essential skills and competencies. So when individuals are achieving the certification, these are essential skills and competencies that they must demonstrate. These include disability management theory and practice, legislation and benefit programs, labor management relations, communication and problem-solving skills, disability case management, return to work coordination, health, psychosocial prevention, and functional aspects of disability, program evaluation, and ethical and professional conduct. Now, there's a third pillar of this federal strategy, and this is supporting workplaces to undertake a program assessment. And as you've heard today, this is something that we're going to certainly let you know more about as we go through presentation today. So employers are offered free return to work and disability management program assessments through the internationally recognized program assessments called the Consensus-Based Disability Management Audit and Workplace Disability Management Assessment. These internationally recognized assessments are also delivered under the auspices of the IDMSC, as mentioned earlier, and again are internationally recognized. These are psychometrically stable, legally defensible forensic program assessment protocols. The Workplace Disability Management Assessment is something that can help improve or develop a disability management program. So whether a workplace has a disability management program in place or is at the point of considering how to go about one, there are a few details to note here. This Workplace Disability Management Assessment is condensed. So as mentioned, there are two different types of assessments. However, this assessment, which is currently free, is something that involves less time and fewer resources, as it's intended to provide a fairly quick process for an organization to be assessed. It involves interviews with key representatives within the organization and a review of documents. And the key representatives noted here, this is typically going to be the person within your organization that knows the most about how disability management works or how the organization currently helps employees return to work from an injury or an illness. This could be one person or it could be a few people, depending on the size of the organization and how developed the program is internally. And the review of documents is quite straightforward. It's a review of a copy of any existing policies or processes that are related to this. The Workplace Disability Management Assessment considers 16 key elements that are supportive of best practices, which I'll explain further in a moment. And the assessment looks at both occupational and non-occupational illness and injury processes. So in other words, it looks at both how does it work if an employee is injured at work or absent and unable to return to work immediately due to an illness or injury, whether it's work-related or related to something from outside of work. This process is confidential. An organization's participation in a workplace disability management assessment is not disclosed to any external parties. The name of the organization is kept confidential, as well as who has participated in their assessment. And this is done just to ensure that workplaces are comfortable in opening up what can be some very internal information and trust that this assessment will be conducted professionally and privately. The 16 key elements mentioned earlier are falling into three overall categories. The first is disability management policy and workplace resources. The assessment looks at the following factors: joint worker management, support and empowerment, responsibility, accountability and authority, workplace culture and policy development, information and communication management, benefit design and influences, knowledge and skills of the DM practitioner. And in a second category, looks at disability prevention, including accident prevention and safety programs, occupational ergonomics, health promotion and wellness, injury, disability, and lost time patterns, and disability cost benefit data. Thirdly, a category of, oh, and is this Leslie?
Yep, you've got about 5 minutes.
Perfect. Okay, thanks, Leslie.
No worries.
The third aspect in the assessment is early intervention and timely return to work process. And this includes early intervention and worker communication protocols, case management procedures, return to work coordination, transitional work options, and workplace accommodations. When an organization goes through an assessment, there is scoring provided to help an organization see how it currently stands in relation to what's considered to be some best practices in all 16 of these key elements. In addition, and it's not shown here, but in addition, an organization is also provided with a comparison with national and global industry averages. So this will help an organization to see how it's currently standing in relation to disability management in its industry, both in Canada and abroad. Ultimately, after an organization participates in an interview and provides some documentation, an assessment report is provided, which provides a roadmap for next steps. So again, this is confidential and delivered to the individual who requested the assessment, identifies strengths, opportunities, and recommendations in all 16 of these key areas. As well, top recommendations are highlighted to help the organization really identify out of all of those elements, what are really the key things to think about in terms of next steps. The report also includes detailed appendices that explain the elements, the best practice considerations, and actually provide quite a bit of information for an organization to take away. Now, when considering the timing and relevance of an assessment, a few factors to consider are in addition to the number of benefits we covered earlier in this presentation, there are some legal requirements. Some organizations will have the requirement to meet certain accessibility standards. So there are accessibility acts throughout Canada. Not every jurisdiction has one. However, many jurisdictions do. And all of the jurisdictions that have an accessibility act have within those accessibility requirements the requirement to ensure that there's accommodation of employees with disabilities and employment of workers with disabilities. Now, in addition to the accessibility requirements, there's also workers' compensation requirements. And I'm not going to go into this into a lot of detail due to the time left here today, but briefly, all jurisdictions in Canada have workers' compensation legislation. Ultimately, there's a requirement for employers to cooperate in return to work efforts, and to most of these requirements include accommodating employees and trying to return someone as soon as possible. In BC, as mentioned by Wolfgang, there's a new legal duty to cooperate and duty to maintain employment in effect January 2024. And finally, just very briefly, probably everyone will be aware, but throughout Canada, without exception, are Canadian human rights requirements. Every jurisdiction protects disability. So every province, every territory protects disability, and ultimately employees with disabilities must be accommodated and up to the point of undue hardship. There are some resources here that we'll share the links to after the session. Oops, pardon me. And this includes links to our workplace disability management assessment. If you wish to apply for one of these assessments, again, they're currently free. And I myself am overseeing that program and am available for you if you have any questions. And it should be noted that this opportunity is free in Canada until June 2024. There are some limited spots available. At this time, there's not really a risk of missing out, but if your organization may be interested in having a workplace disability management assessment, then I would highly encourage you to submit an application, and feel free again to reach out about that. So,
thank you so much,
sorry,
Steve.
Leslie, go ahead.
No, thank you so much, Steve and Wolfgang. That was great. Amazing that you managed to do that, share so much information in such a small block of time. So thank you for that. I've opened the chat up, I think, for any questions to come forward. Are people able to, have people seen that? I posted something in there just welcoming people, so I'm just wanting to make sure that people are able to see that and do that. Yeah, we've got some thumbs up. I really, while we're waiting maybe for people, if they have any questions, I was really struck by a number of points that you raised during your presentation, and I have a question that maybe gets at this key of attitude, and maybe you can help elucidate on that a little bit more by talking about giving examples and of best practices and standards in disability management. You pointed to those in the presentation, but maybe I wonder if you could elaborate on those a little bit more.
Sure. Yes, absolutely. So I think a key takeaway for an organization when thinking about disability management, overall, as you've seen, there's a lot of detail to go through. So what I would suggest is key takeaways would be probably first and foremost, some collaboration in the workplace. As was mentioned, and I think Wolfgang's personal experience kind of attested to this about how significant and necessary it is to have some collaboration and cooperation between management and employees in the workplace. Ultimately, you can do a lot in the workplace just through management initiatives, but ultimately to really have the best results, you need to have a collaborative environment where there is input from the workplace. And I think that ties into another key recommendation, which would be education. So that would be to ensure that people within the organization, whether it's leaders, managers, and workers, understand the commitment that's in place if someone does have an injury or illness and how it works. So who do they go to and what supports are in place? As I'm sure many tuned in today can maybe relate to, if you're a leader in an organization, and all too often there's a very stressful moment that comes when one of your employees experiences a disability of some sort, and you really have no idea of what to do or who's responsible for that, what your role is in that, and certainly concern for the employee as well. And going along with this is capturing all of this in policies, procedures, documenting your process and your program that you've got. So as mentioned today, there's a lot of other considerations, but those are certainly three overall key pieces to keep in mind when you're trying to implement and maintain wellness in your workforce and an understanding of how to support individuals that have a disability.
With regard to the assessments themselves, can you speak a little bit about, I think there's three questions that seem to arise with regard to the assessments. Who needs to be involved? Mm-hmm. How long will it take? And what do we do? What's in place to help protect confidentiality?
Sure. Yeah, I think those are common questions we hear as well. So in terms of who's involved, probably only touched on this briefly. Ultimately, within an organization, the only at a minimum, it would be involving one person who's most familiar with your disability management or your return to work process. You might have different names internally. Not everyone calls this a disability management process. It might be called other things. It might be under human resources or under a safety department or just under managers to under their accountabilities. But however it's called, we would like to interview someone who is most familiar with how it currently works within the organization. So typically that's a 2-hour call, and it's a one-on-one call with a certified auditor on our end. This is intended to be a positive experience. So we do run through quite a number of questions, but again, it's one-on-one, it's privately with an auditor on a Microsoft Teams call, just like this. And now each auditor is under a confidentiality agreement. They can't disclose any information about the participant in the interview or the organization, and that's our standard approach for everything about the assessment. So rest assured that there is a layer of security there for any information that's shared. Now, in terms of how much time is involved, again, this could be as little as someone participating in a call for 2 hours and providing us a copy of your current policy that you have in place. So from that perspective, it could be a very small time commitment. In a larger workplace, let's say where you maybe already have a disability management program or policy or department, we might involve a few people. So perhaps a manager of your disability management, someone that does the work day to day, possibly someone from your safety area. Possibly we could include as well a key stakeholder such as a manager or a union representative or worker representative of some sort. I think an important takeaway for an organization considering an assessment is that to start off, you submit an application. I will actually reach out to you and have a conversation with you to start off, just to give you an overview of how it works, and to just run through who you may want to consider including in the process. Ultimately, it is up to each organization on who they include, we're going to just do our best to work with whoever you've identified, and again try to make it a positive experience. A report is provided, and so part of the timeline on that, just to lay it out, once you submit an application for assessment, this can be booked quickly or further in advance. So there is some flexibility on that. The interview or interviews, if they occur, we typically provide a week or two for that period. And then ultimately, we like to provide you a report within about 2 weeks. Sometimes it's a little longer depending on the season, but we're typically going to provide you quite a detailed report in about a 2-week period.
Great, thank you. I'm going to ask a big question to be answered in a little short window of time. and it's a little bit, Wolfgang, we've talked about this. It has to do with the changing ground of legislation across jurisdictions in the country. And there are some important pieces coming up that might be of particular relevance to employers. And I wonder if you can just draw that out a little bit. I think there's some pieces with regard to BC in particular, and there may be others.
Well, one of the things that obviously BC was one of the last jurisdictions, workers' comp jurisdictions, where you didn't have a return to work obligation. I mean, you've had return to work obligation under WSIB legislation for many years, and then about 4 or 5 years ago now, I guess, there was a return to work obligation that was introduced under Alberta WCB legislation, which then was changed when the government changed from a straightforward return to work obligation to a duty to cooperate. And so we finally caught up here in BC with a duty to maintain employment if you have more than 20 employees, and that is 2 years retroactive from the day that it becomes effective, which is the ordering council making it effective is January 1st, 2024, and then the duty to cooperate, which applies to every employer, basically. And that's kind of what ultimately this is all about, is trying to stay engaged, keeping people attached to the workforce. Because by the time you've been out of work for between 6 to 8 months, sort of the latest evidence that we are seeing is that when you've got at 6 months post physical injury or impairment of sorts, individuals that have not gone back to work will have also have an associated mental health impairment. That's kind of the irony is that in a previous life, I was one of 3 non-military members, part of the National Veterans Affairs Advisory Board. And I remember a conversation with the Chief Medical Officer for Veterans Affairs where 10% of all impairment cases are strictly mental health PTSD and those kind of things. But the 10% are severe physical impairment cases, blind, amputations, all those things. And the bulk, 80% in between, is a combination. What really will start out as a physical health impairment and could initially be quite minor, but involve chronic pain, not being able to go back to work, and then it morphs into a serious mental health challenge. And that's, of course, where you have passing the buck happening all the time. And I know we are out of time, but I thought this illustrates an interesting case that was highlighted by at a steelworkers, because I'm a lifetime steelworker member, health and safety conference, where an individual had suffered a significant physical health issue, did go back to work, ended up morphing into a mental health issue, which then ultimately turned into an addiction issue as well. And it was profiled. This fellow was sort of in his mid-40s, and on the way back, everybody went down the line. The addictions folks said, well, we can't sort of deal with the addiction until we deal with the underlying mental health issue. And the psychiatrists and psychologists that were trying to deal with that said, well, unless you deal with the underlying physical health issue, which included chronic pain and all those things that go with that, we can't deal with that. And at the end of the day, the individual committed suicide.
Oh my goodness.
That was just something that will stick out forever, because it was this was 700 member steelworkers health and safety conference where this was profiled. I mean, that's kind of the reality of what we are dealing with, and why we can have such a positive impact in making a change.
Yeah. Thank you. That story highlights the importance of this work and highlights the contribution of these assessments. So thank you very, very much. I think what I'm really happy about in terms of these assessments is that they also look at occupational and non-occupational incidents and events, and will be very helpful, I think, to organizations. So we urge you as organizations to apply for one of the available free assessments. You can contact Steve as indicated, or reach out to inclusion@meahr.ca for further details. I think we've got a slide that we can put up with regard to that. And as we close, I just want to thank you, Wolfgang and Steve. I'm grateful for the time and energy you've put into this webinar, for helping us to address this important topic, and for all the work that has led us to this point and that will serve us beyond. Thank you, everyone, for joining us. We hope this is the beginning of more conversation around supporting persons with disabilities in the sector. I welcome you to join in this discussion and let us know what you need to help also advance work in this area. Again, we're available at MiHR, and we are very open to your emails and exchanges at inclusion@meahr.ca. Thank you so much, everyone.
Thank you.
Thank you. It's great.